In this video, I will discuss thyroid misdiagnosis, the hidden epidemic doctors miss. Your thyroid tests are normal, but you still feel exhausted, gaining weight, and struggling to focus. What if I told you that the real problem isn't in your blood work, but it's inside your cells? Today we're exposing a shocking truth about thyroid misdiagnosis. While millions are suffering from symptoms doctors ignore, it's called cellular hypothyroidism. And if you've been told that your thyroid is fine, but still feel awful, this could be the missing piece. Imagine your body is a locked house. Your thyroid is making keys, but what if those keys don't actually open the doors? That's exactly what's happening to so many people, including me. And the worst part, most doctors don't even check for it. If you think your thyroid medication will fix this, think again. There's more to it than just taking this. The problem isn't how much hormones you have, it's whether your body can actually use it. And today, I'll show you just how to fix it without wasting years on misdiagnosis. Thyroid disorders are among the most common endocrine conditions, yet accurate diagnosis and treatment remain challenging, particularly in cases of thyroid misdiagnosis and thyroid resistance. These conditions present complexities not fully captured by traditional diagnostic methods, often leading to improper management. This summary explores the underlying physiology of the thyroid, the reasons for misdiagnosis, the biochemical mechanisms leading to cellular hyperthyroidism, and potential therapeutic solutions. Hi, my name is Chirag Patel. I spent years diving deep into thyroid health, not just as a researcher, but someone who has lived with hypothyroidism for over 15 years. Today, I'm here to share this science-backed truth that could change how you view your thyroid health forever. Physiology of thyroid and cellular function. The thyroid gland plays a crucial role in metabolic regulation, primarily through the production of hormones, thyroxine, T4, and triiodothyronine, T3. T4 is considered a prohormone and is converted into T3, the more biologically active form, in peripheral tissues such as the liver, kidneys, and muscles. Once produced, T3 binds to thyroid hormone receptors within the nuclei of the cells, initiating gene transcription that regulates metabolism, energy production, and cellular growth. In a healthy thyroid function, the pituitary gland monitors circulating levels of T3 and T4 and releases thyroid-stimulating hormone, accordingly to maintain homeostasis. When levels of T3 and T4 are insufficient, TSH rises, prompting an increased production of thyroid hormones. However, cellular hyperthyroidism occurs when T3 and T4 are unable to enter the cells effectively, despite normalizing circulating levels, leading to symptoms of hypothyroidism at cellular level. Thyroid problems are notoriously tricky to diagnose. In fact, millions of people suffer from fatigue, depression, weight gain, and more, despite having normal thyroid lab results. That's because traditional thyroid testing focuses primarily on TSH levels and overlooks what's happening inside your cells, where the hormones are actually needed to work. Imagine your thyroid is producing the right amount of hormones, but they can't get inside your cells to do their job. That's cellular hypothyroidism, and is a much more common issue than most people and even doctors may realize. A significant challenge in diagnosing thyroid disorders stems from the reliance on TSH levels as a primary diagnostic marker. TSH is a reliable indicator of thyroid gland function, but does not always reflect the thyroid hormone status at the cellular level. Many patients with symptoms of hyperthyroidism, such as fatigue, weight gain, and depression, are diagnosed based on a normal TSH level, even when they may not have the thyroid hormone resistance or impaired intracellular hormone transport. This misdiagnosis occurs when the thyroid feedback loop is incomplete, only when assessing TSH and free hormone levels. The problem is that doctors make all their judgments based on TSH and don't have a clue what's going on at the cellular level. The cellular uptake of thyroid hormones depends on a variety of factors, including the integrity of the thyroid hormone transporters at the cell membrane, the presence of adequate nutrients like selenium and zinc, and the functioning of deiodinase enzymes that convert T4 into T3 at the cellular level. Without evaluating these factors, patients are often either left untreated or inappropriately treated with thyroid hormone replacement that does not correct the underlying cellular dysfunction. Biochemical mechanisms behind cellular hypothyroidism. Cellular hyperthyroidism or thyroid hormone resistance occurs when thyroid hormones are not properly utilized at the cellular level, even when the levels in the bloodstream appear adequate. Several biochemical processes contribute to this phenomenon. Number one is impaired thyroid hormone transport. Transport proteins such as monocarboxylate transporter 8 and organic anion transporting polypeptide are responsible for carrying T3 and T4 into the cells. So defects and deficiencies in these transport proteins can prevent thyroid hormones from entering the cells, leading to functional hypothyroidism despite normal serum levels. Deiodinase dysfunction is another problem. So inside the cells, you have these deiodinase enzymes, D1, D2, and D3, and they convert T4 into T3 or deactivate thyroid hormones. So when you have inflammation, nutrient deficiencies, or genetic factors, this causes impaired activity of these enzymes and therefore reduces the conversion of T4 into T3, leading to low intracellular T3 concentrations. As a result, even if T4 levels are showing up good, T3 levels may be insufficient at the tissue level, causing hypothyroid symptoms. Inflammatory cytokines and hormone resistance. Inflammation is a key modulator of thyroid hormone function. Elevated levels of pro-inflammatory cytokines such as tumor necrosis factor, which is normally called TNF-alpha, and interleukin-6 can disrupt thyroid hormone signaling pathways. These cytokines can reduce the expression of thyroid hormone receptors and alter the sensitivity of cells to T3, further contributing to hormone resistance. So reducing inflammation is huge. Nutrient deficiencies. Now, certain micronutrients such as selenium and zinc and iodine are essential for thyroid hormone synthesis and conversion. Selenium is particularly important for the activity of the deiodinase enzymes, while zinc will support the structural integrity of the thyroid hormone receptors. When you have deficiencies in these nutrients, it can impair hormone metabolism and receptor function, leading to cellular hypothyroidism. But here's the game changer. By addressing these underlying issues, boosting nutrient levels, reducing inflammation, and even supplementing with the right form of thyroid hormone, you will notice the difference. You'll experience more energy, weight loss, and mental clarity. And the best part, by understanding your body's needs on a cellular level, you can start by making small changes that lead to life-altering improvements. So here are the solutions for addressing cellular hyperthyroidism and thyroid resistance. Improving thyroid hormone transport is one of them, ensuring adequate levels of nutrients like selenium, zinc, and magnesium, which can support the function of thyroid hormone transporters. Optimizing thyroid hormone conversion. Supplementing with T3 in combination with T4 may improve outcomes in patients with impaired deiodinase activity. This approach helps bypass the reliance on conversion of T4 into T3, ensuring that the active hormone is available for cellular function. Additionally, addressing systemic inflammation through diet and lifestyle changes and anti-inflammatory treatments may help restore normal enzyme activity and hormone sensitivity. Finally, a more comprehensive testing approach is crucial for accurate diagnosis. In addition to measuring TSH, clinicians should evaluate free T3 and free T4 and reverse T3, the markers of inflammation and nutrient deficiencies. I've seen this transformation personally both in myself and in the people I've helped. So not long ago, I was tired and frustrated and convinced that there was something that my doctor was missing. By digging deeper into science of cellular hypothyroidism, I discovered what was really missing inside my body. So in conclusion, thyroid misdiagnosis and cellular hypothyroidism represent complex challenges that arise from an incomplete understanding of thyroid hormone metabolism at the cellular level. Traditional diagnostic methods rely solely on TSH levels, are insufficient for capturing thyroid hormone resistance or cellular hypothyroidism, leading to an underdiagnosis or mismanagement of patients. Always talk to your doctor about making these changes and also request a full thyroid panel test. Hope you've enjoyed this video and please like and subscribe.